10% of the state's general fund expenditures up for being cut. Tens of millions of dollars in programs that support the state's most vulnerable populations could go away. There's a lot at stake as lawmakers consider these proposals. One program offering resources to children with disabilities, called Part C, serves hundreds of families across western Montana.
And as Augusta McDonald reports, people who depend on those services are heartbroken over what they call devastating cuts.
The Part C program packs a punch, using developmental services to give kids a better shot in life. There was shock and outrage here at the Child Development Center upon hearing that some of their most critical early intervention programs were on the chopping block.
We have never, ever seen cuts in Part C like this. Unfortunately, if Montana was to eliminate these services, we would be undesirably distinguished as the only state in the union that didn't provide this service.
One Missoula mom says that program helped her son, who was born with developmental problems, and gave their family independence.
Without those services, we would, I don't know where, he would be or I would be, or if he would be in an institution or something like that, because we wouldn't have the support. So it's been truly a lifesaver for our family.
Department of Public Health Information Officer John Ebelt says this situation is heartbreaking.
You just can't get to that dollar amount without there being tremendous impact, such as the Part C program, but many programs in many areas of our department.
Ebelt says the cuts are proportionately applied to each state agency, but when that breaks down, the Department of Public Health and Human Services has had to come up with $105 million in programs, which is 46% of the total savings that Governor Bullock is seeking. That's $226 million. Reporting in Missoula, I'm Augusta McDonald for MTN News.
The governor will start going through all of these proposed cuts agency by agency starting next week.